$914 Social Security checks are arriving tomorrow, November 1st. Also in Congress, the debate is continuing how Social Security has been a disaster and failing on many different fronts.
The Social Security disability program is broken. It's broken in its finances, it's broken in its process, it's broken in its modernization. The solution to these problems is not a dollar amount. As we have seen far too often, the federal government throwing money at a problem does not fix the process.
I'm going to play the full video clip of what is going on in Congress and how Social Security is doing a horrible job, what they plan to do about it. Also, I'll let you know the exact payment schedule for November as it's coming up. I'll let you know the exact dates of when you'll get paid your Social Security check. And when it comes to Congress and how they are dealing with the disaster that's going on, if we take a look at this headline right here, Social Security devastating shortcomings thoroughly questioned by lawmakers, how program is failing those with disabilities and more. I'll let you know it's a really bad situation for anyone on SSDI as the program is completely failing them. So I'm going to give you the updates on the payment schedule, let you know who's getting the $914 checks tomorrow for Social Security, and let you know what Congress is saying. Play the full clip of what they're saying about SSDI. So if you're on SSDI, SSI, any other Social Security program, you're definitely going to want to watch this video all the way through, and I'll give you other important updates as well. Before I dive into the main content, if you appreciate these Social Security updates, hit the like button and subscribe to the channel for more Social Security updates on increases, decreases, what's going on in Congress. And this video is sponsored by my company, YSense. If you or anyone you know is looking to raise your credit score, remove negative items from your credit report, I got a link down in the description below. Contact me for that. All right, let's get into it here. $914 Social Security payments on November 1st, 2023. Who will receive them? So what's going on here is the payment amounts for beneficiaries depending on their status. This is for supplemental security income for SSI, where individuals could get up to $914 per month, and then jointly it could be $1,371 per month. And essential persons, or those who live with someone receiving SSI benefits, could be entitled to $458 per month. So whatever you got last month, it's going to be the same this month, and the payments are coming tomorrow, November 1st. And then when it comes to the other payments for the payment schedule, November 3rd is for Social Security payments for people who've received Social Security since before May of 1997. November 8th is going to be the first payment, that Wednesday, for people on the with birthdays 1st to the 10th. With birthdays the 11th to the 20th, November 15th is going to be the payment date then. For the remaining birthdays, 21st to the 31st, November 22nd is going to be the payment date for those. So that's the payment schedule going on for November. And when it comes to Social Security and the disaster and devastating effects, so Social Security, devastating shortcomings thoroughly questioned by lawmakers, how program is failing those with disabilities and more. So, excuse me. More than 1 million Americans are still waiting for initial decisions on disability benefits that currently take on an average 220 days to process, which is definitely really, really bad. So that means anyone waiting for SSDI just to get into the program has been waiting for so long. What was said here is pending levels and wait times for determinations on initial disability claims and disability reconsiderations are at all-time highs. For the first time since the programs began, pending initial disability claims have exceeded 1 million. Applicants are waiting on average 7 months for a decision. This is simply not acceptable to the public, to you, or to us. So, as I played you that video clip in the beginning, they're saying a dollar amount is not the issue. Basically, it's just the incompetence of the entire program. As you may have heard before, we have the overpayments, billions of dollars that Social Security Administration somehow did not see that they were overpaying people. Now they want those overpayments back, and the money is gone. I think it's somewhere in the ballpark of $20 billion over the course of a few years. What is going on with the Social Security Administration? If you're on Social Social Security, what are the problems that you're having? Let me know down in the comments below. I'm really curious with your Social Security checks. Are they coming through? They're on time. But what about if you call up, if there's any issues? What are the wait times with that? I'm really curious. Let us know down in the comments below. When it comes to the SSA. Another thing said here, this is simply not going to be solved by putting more resources and money into it. If we don't have the right policies, we're defeating ourselves. So take a look at this video clip as it talks more about the incompetence, what needs to be done with Social Security and your Social Security check.
Ever. Thank you. Next, we'll go to the gentleman from Florida. Mr. Stubbe, you're now recognized.
Thank you, Mr. Chairman. The Social Security Disability Program is broken. It's broken in its finances, it's broken in its process, it's broken in its modernization. The solution to these problems is not a dollar amount. As we have seen far too often, the federal government throwing money at a problem does not fix the process. Congress has already given hundreds of millions of dollars to the Social Security Administration to modernize its claims process. And if we have heard here today, SSA has failed completely. The Dictionary of Occupational Titles, the SSA's list of jobs, was created more than 40 years ago and last updated in 1977. I wasn't even born the last time it was updated. Some applicants have been denied disability because Social Security told them they could perform such jobs as egg processor, dowel pin inspector, or nut sorter. Yes, I said nut sorter. I mean, that's probably a good title for leadership in Congress these days, given what's going on. But though I know some folks in the Social Security Administration is denying claims based off of obscure and antiquated jobs that may not even be available. I have a gentleman who I know through my men's group, who I've gotten to be very close with, who has type 1 diabetes, is losing sight. He's now like medically blind. He's had one surgery in one eye, can't see in the other eye. He's an Amazon driver part-time. He obviously can't drive a vehicle because he's now blind. I encouraged him to go to Social Security disability because that is why it was created, to help people in his circumstance, people that were working, now not working for a medical disability. And just to get the appointment was like 60 days out, just to get to the appointment to be able to then start the process, which then, we're talking about how long that takes. We're here today because of the historically high backlog of cases. Today, over 1 million Americans are waiting an average of 220 days for the administration to decide their initial claim, a more than 83% increase since 2019. The administration publishes its average hold time for its 1 to 800 number. Its own data shows that last year, the average time someone waited on hold was 32 minutes. So far this year, it's up to 36 minutes. It's unacceptable. The American people simply deserve better customer service from the government that they fund. Receiving Social Security benefits should not be an overnight process. There should be a clear vetting and examination process of claims, and not every claim will be or should be approved. But a timely process to examine cases is absolutely necessary. And these decisions need to reach transparent conclusions for the American people to take the next necessary steps. In one case earlier this year, Northern California District Judge Susan Ilston wrote that a disability claim denied by Social Security that ignored key physician records was, quote, so vague as to be essentially unreviewable. The decision was reversed by the judge and ordered SSA to pay benefits to the claimant, a woman suffering with schizophrenia, depressive disorder, and delusions. Mr. Camp, according to your testimony, half of the processing time at the initial stages of the application is consumed by the optional second step reconsideration. You note that the Social Security Administration's minimum acceptable number of days processing is 60. However, and you just stated it to the question of the chairman, current data shows that in my state of Florida, reconsideration adds 323 days to the 300 days at the initial stage. It takes 623 days for someone in Florida to get a disability. Can you explain why my state of Florida specifically has such long wait times?
There are several factors that cause the states to vary. One is that they're administered by separate state DDS programs with different staff, different management, different functionality. Another interesting factor is the extent to which the successful programs have been implemented in that state. One is health information technology, modern acquisition of the records, immediate, affordable, doesn't need to be staffed. That is a success in Iowa, say, where the processing times are very, very low because there are two large hospital chains in Iowa, and that provides hit access for the records, shaves off many, many days. In Florida, not so much. So there is less use of technology in Florida, and that slows it down.
When I have, my district alone is the most elderly district in the country. So obviously, that's also part of the challenges too. If the Social Security Administration eliminates the reconsideration phase, how do they ensure fraud is not occurring? And furthermore, exactly where would available resources be reallocated?
If you focus on what is actually done at reconsideration, you would see that it's not going to catch anything. If you don't do any work at a step, there is no need for more than one day for that. If you are merely clicking a box that says agree, you haven't read the file, you haven't caught anything, you haven't caught false statements, you haven't caught reliable medical opinions. It isn't of any value to do the same thing again hundreds of days later, 9 times out of 10. It's just not helpful. The quality can go up at initial if you take the existing resources, the existing staff, and give them more capacity to take a look, a more careful look at initial. All of Social Security's studies, now they need to report more on what happens with these pilots and all these studies that they've been doing about the claims process, but all of it reveals that if you have a DDS only doing initial, they do higher quality work. They pay more attention. They have more time.
I just want to, my time's expired, but I want to thank all the witnesses for being here today.
Thank the gentleman from Florida.
What are your thoughts on what this was said about Social Security? Is anything actually going to be done about it? Or are they just kind of pointing out all the problems and not solving those problems? Let me know your thoughts on that. And that is all the news that I have for you today to hopefully brighten your day a bit. Here's my daughter Bella's tip of the day.
Hi guys, so my name is Bella. This is the tip of the day. If you make a mistake, then it's okay. You learn from your mistake, it makes you a better person. So it's okay. It's okay. We still love you. We like you a lot. Bye.
Thank you so much for watching. Appreciate your support. If you want to see the latest of what's going on with Social Security and potential increases, you're going to want to click this video right up here as I'll go over more in details of what's going on. So click that video now and I'll see you in that video. Take care, be safe. Thank you for watching.